Welcome to the Olson Family Dental YouTube channel. I'm Dr. Matthew Olson.
And I am Dr. Carl Olson. We are a father and son team here in Norwalk, Connecticut. Our objective for this channel is to take some of the mystery out of your dental care and to encourage pertinent questions between patients and dental professionals.
Though we do want to address the frequent issues facing our patients today, rather than give direct medical or dental advice, we would rather give you information that allows you to generate an educated discussion with your dentist. In other words, in a YouTube video type setting, and without directly examining patients and having all the necessary diagnostic tools, we'll hesitate at giving specific advice.
That said, we often get questions regarding insurance issues, new types of dental procedures, diagnostic tools, implants, temporomandibular joint issues, sleep apnea, coding, which leads to dental insurance problems, informed consent, treatment options, cosmetic dentistry, and elder care. Hopefully we can give both our opinion and some book knowledge so as to empower practical discussions leading towards predictable standard of care treatment. More understanding leads to better discussions, and better discussion lead to better care.
Please leave comments below on any topic you'd like to hear more about. We hope to upload videos regularly, so please check back often and don't forget to subscribe.
Thank you very much for visiting with us today.
We really appreciate you coming to our channel, and we hope that we can offer you relevant and pertinent information. That said, our hot topic for the day is flossing. I have an article here from the New York Times. And it has to do, I just printed this out, has to do with about feeling guilty. So, feeling guilty about not flossing, maybe there's no need. So, the whole article is, I don't want people getting the wrong idea about the article. A lot of people take this article to mean that you don't have to floss. It's not exactly true. There aren't very many studies that confirm the long-term benefits of flossing. However, common sense would lead you to do whatever it takes to reasonably keep your mouth clean. And it usually shows very, very much when a patient comes in and has neglected their flossing or brushing, because they immediately start breaking down in their gums. And they're not happy, they're not comfortable, they're bleeding, they're swollen. We don't want this for our patients, and it's unnecessary. The idea that keeping something clean doesn't need to be proven. Keeping anything clean always is better. Okay? I don't care if it's your car engine or keeping your hands clean. There have been studies for years that have been trying to get us to keep our hands cleaner. They may not have even proven that yet, but the point is, common sense leads us to say, whatever it takes to get your mouth clean and keep it clean day over day will lead to a better level of dental health and comfort. And we fully expect to be able to guide our patients to a lifetime of good, healthy mouth and gums so that they can eat dinner with their families, go out to a restaurant, have a snack, and not be worried about comfort or function for their entire lives. And this is completely reasonable today. Some people would say maybe not, but we actually have people that are in their middle 90s in our practice that have all of their teeth or most of their teeth, and they are comfortable and they are functioning well. And this is what we would like to see happen to you. So when we see an article with poo-pooing flossing, that article may just be something that you take and glance at and say, that's interesting, and get on to something more important, like the Ann Landers. the overall issue with this article, as far as I can see it, is that they're right in the sense that there aren't that many long-term studies proving the benefits of flossing. However, if you do believe that dental infection can kill you, which it can, that we know, We believe it.
we believe it, dental infection can kill you. And we don't know the extent of the damage that's done by dental inflammation today, although there are plenty of studies that are suggesting that it does all kinds of bad things. But that aside, before the year 1900, it is my understanding that dental infection was a top 5 killer. So, if you believe that, now that we have antibiotics today, it's a little bit less, but now if you believe that, and you also believe that flossing offers some level of cleansability, at any level, a minute amount or a big amount, whatever you believe, that means, then and therefore, you do not need a scientific study to prove that flossing does something. So, the overall philosophical question is, do you need a scientific study to prove pretty much whatever you do? Do you need a scientific study to tell you that hand washing is a good thing? Do you need a scientific study to tell you that bathing's a good thing? That showering's a good thing? I don't.
Probably not.
Probably not. I don't need those studies to tell me that. So there's plenty of stuff in dentistry that we can go over where we have scientific studies to back up what we do. In the case of flossing, it does offer a level of cleansability. Therefore, no matter what any study says or doesn't say, in this case it's the or doesn't say part of it. Flossing does help, and we certainly encourage you to brush and floss regularly. So, that said, we're done with our first video. Hope you like this intro. We will hopefully upload stuff as often as possible. Thank you so much for watching. Don't forget to subscribe.